You want to marry a robot or you want to marry people like Francan? Prefer Francan or robot?
Francan or robot?
MCQ only 2 choices, Francan or robot?
If you could say whatever you tell your boyfriend agree, would you prefer that boyfriend?
No, I want to wait, she bring here.
That time I saw one of my patient, I dropped blood. He was skinny, but then the cholesterol high. Then I got another patient, very fat one, but the HS reading like nothing highlighted. You could be skinny, but not necessarily healthy. I want to lose weight. My first time actually break up.
Wow, okay.
Then after that, break up, you want to revenge lah by being the better ex. So alright, hi guys, welcome back to Take MC, where we have our medical conversations with Dr. Lai and Francan and me, myself, Marthius. Here today we have 2 special faces again. Last time we had Etern to come along, and today we have
Xin Yi
and
Reny.
Xin Yi, full-timer. And ready now? You are
Still part-timer.
still part-timer. Okay. Yeah. Okay, so we'll be continuing a little bit with the previous section where you found out how Etern as the CE, the clinical executive, actually works. That's on the higher level. And then we also mentioned about how some of our new employees come in, right? And even with no experience, and some even with experience. So we have actually the best examples here today. And Xin Yi, right? You are a EN?
Soon to be RN.
Soon to be RN, you know. So she joined us when she was a enrolled nurse, correct? Yeah, so maybe you can share with us a little bit of your experience as maybe like what's the difference between like nursing and actually working in Etern Medical? Or is it the same?
It's mostly the same lah. It's just the ward.
The ward?
Lah.
So how about some people, because some of our audience don't know like what is ward, at ward. So maybe you tell us what.
Mostly like you change their diapers.
Change diaper, okay, yeah.
Then afterwards you do dressing.
Okay, that's how much.
So it's real, like, it's true, not just a stereotype lah.
Yeah.
Then afterwards dispense medicine now. Same also.
So the principle is the same.
Yeah, mostly the same.
But the practice is different.
It's more
Principle and practice.
The dressing wise, right, is very sterile.
More because the patient are more vulnerable, the wounds are bigger.
Or worse.
So the principle and practice. You learn principle first. Your principle must be strong. Then when you come out with different kind of practices, you refer back to your principle. Then it's always the same thing.
Okay, that's interesting because sometimes people think nursing and clinic like very different.
Right? Yeah.
It's not really like.
Actually, there's another dimension. Specialist clinic. You haven't seen a specialist clinic yet. Yeah. So, but I think when I started as a houseman, I also go to the ward. Then I thought, wow, so ward patients tend to be very sick. ICU are usually more sick, but that's not the whole healthcare. Healthcare got other perspective, but I think for newbies, because that's the most labor intensive, so you always end up in the ward first. But that's not if you don't like the war zone, because it feels like a war zone actually most of the time. But that's not all of healthcare.
Actually, working in clinic also got war zone also lah. Maybe not war, but firefighting lah.
Something like that.
Maybe of firefighting also have.
So R&D, research and development. It's very academic. You do research based. You collect data, things like that. Healthcare got a lot. Health admin also. Health administration.
Correct lah. Administration is something that people don't
policy,
see a lot.
Like in the office work like that.
So what do you like actually? Do you prefer working nursing or prefer like working in the clinic?
Both is fine.
Both is fine. Like they have the pros and cons.
Correct. Have.
So what's the pros of working clinic and then what's the cons of working clinic?
Pros of working clinic is
alamak. You're not everywhere leh. Tele Francan, yeah.
Tele colleague.
It's like hospital. The patients are very angsty. Worse than clinic.
Wow.
Yeah.
Wow.
Then they will order
demanding,
you.
is it?
Yeah.
Whoa.
Demanding.
Nowadays they have this Protect Healthcare Worker Act, right?
Yeah.
So are you all taught all these things?
For me, haven't yet lah.
I think there's a chain of reporting nowadays. Yeah.
So you actually studied first, right? Then graduate as an EN.
Yeah.
Then you start working here.
Yes.
Then you continue study, correct?
Yes, correct.
So how does it feel to go back there? Does it help you with the clinic experience? Help you better than your
because of the medicine.
Because of the medicine.
Yeah. Because we learn more drug in advance first. Then I can learn slightly lesser drug.
Okay,
Fantastic.
I see. So that's one good thing lah. I think a lot of people don't know that over here we train our drugs also, right? You do drug tests. And for you also, Reny, right? You don't have any experience, right? For clinical or anything, correct?
Yeah, no.
And then last time you said you wanted to join more healthcare line.
Yeah.
So when without that experience, after that, how do you find that having the drug test and whatever that they have trained you over here?
I think more knowledgeable Like I get to learn more about the drug and like the procedures that we all do and like the
On a scale of 10, how difficult was it, the experience?
Good question.
Upon 10, what's the difficulty? Is it like culture shock or piece of cake?
a bit of culture shock
Oh, wow,
because
okay,
it's something new to me. But some of it I'm okay because people around me are all like in healthcare, so I somewhat got influenced by them.
Oh,
People around you as in your family?
My family also,
Okay. Who are they?
My sister.
Sister is a nurse?
Yeah, senior staff nurse.
Okay, so
That's
she
easier.
got a bit of like influence.
Influence already.
Yeah. Okay,
But
so
you feel culture shock, right?
Yeah.
Because when I was a houseman, I also I feel like run over by a bus. Like fighting, yeah, it's quite culture shock. And I felt that for the whole of my tour of duty, almost 3-4 years, because we get rotated every 6 months. Every 6 months we go to a new place. The greenhorn like that. Everything is new.
I think me and Francan a bit different because we slowly move in with like our like medical background. Like, not say medical medicine different we're not so up, but medic background. I think Francan also got his own background. Yeah, you got the culture shock.
Do you like so jialat, so many things to learn?
No leh.
No
Quite fun.
How do you start? Paramedic, is it?
Quite fun. Then difference medic and your paramedic and clinic?
It's more boring or more admin stuff.
More admin stuff. I mean, true lah. You outside, I think you got your crazy paramedic experience
Grab and
also,
go,
right?
Paramedic is grab and go.
Tapao at home. Here you cannot tapao anyhow. Not enough. So I think another thing about working in clinic, right? Actually, like what Francan said exactly, it's less active. I think less working here. I actually gained like a lot. To be honest.
That happened to me also.
Right, I mean you can tell right. Dr. Lai last few episodes you mentioned you were exercising, climb mountain all this also.
Last time when I was in the ward, I was quite slim.
Run around like.
I
mean the ward itself is bigger, correct or not?
20,000 steps easily. You do your step count.
Next time.
Most likely you have 20,000 steps. Like in the clinic, I think 2,005, 3,000 steps. 2,000.
I mean because you sit inside, but for us we run around take medicine. Still can.
But that is the occupational part. So you need to rebalance So that means if you are a clinic nurse, you need to rebalance with your exercise or through your transport. Otherwise you will feel unhealthy.
That's
what happened to me. When I started clinic, I was in the 24-hour clinic, right? Wow, after I do a shift, I need another day to recover, which I thought very funny. But nowadays I work 7 days a week. I don't feel that tired because in between I take my exercise break. And then I feel the rebalancing.
So now you start doing your deadlifting. Dr. Lai also now start doing his own private gym at home, so he's not only painting, he go gym, wholesome lifestyle now. That's why I say like if we go to work, right, then we don't balance off like what you said, right? I think really we just gain weight only. That's why even I myself start exercising. I think the other day you told us that you actually start doing exercising. So what do you do normally?
I only run in the morning.
Run in the morning. How often?
That's good.
Maybe 1 week once or twice.
That's a good start.
Depends on my schedule.
That's a good start. But how do you feel after you run?
Very shook.
Very shook, right?
I don't like cardio.
That's why I tell my patient, money cannot buy the shookness, the endorphin. Money cannot buy one. It's like a free dose of antidepressant.
Where you run actually?
Downstairs my house, there's like a running track there.
Okay.
That's why
you like run around the block.
I also run around the block.
Okay.
I can run 4 clicks around the block.
I think when I run also only on the treadmill in the gym. That's the only way.
Must be creative. Not principle and practice. So it's like you are the gym guy, right? But you know your roots, not the principle of exercise. So then after that, let's say you are in a place where you don't have gym, so you're stuck, right? But you have to apply the principle, and then look. Like for example, let's say you want to do bicep, but there's no gym around your new workplace, right? Then how am I going to get my bicep stimulated in that new place? You must apply the
principle movement of the arm. Then so you do pull up then you do overarm, underarm, grip,
railing Look for railing.
As long as you have the
So principle and practice is important. Like for example, cardio
No, that's already. So I heard you also joining them with Pilates, is it? I don't know.
You don't have to try, okay? Try.
How does it feel actually?
Not bad though.
Not bad
Quite
I feel like
fun.
Pilates is just marketed to women really. It's overhyped. That's what I feel
I mean, At one point, yeah, but I think that's more on your core.
Core.
Yeah.
Assisted, right? The devices assist you.
And like tone your muscles.
I think it's better. Better than yoga, right? Yoga is unassisted.
Okay, for me,
Pilates assists you.
my argument is that you can do the same movements in the gym with lesser weight, and then it's basically the same thing. Correct or not? Then you don't have to pay all so much for all the classes, all this nonsense.
But maybe the women, the structure and the mechanics is a bit different. But speaking from a uncle, right? My stiffness is quite impairing. Like for example, I cannot kneel.
Yeah lah.
Because I got the left ACL injury 20 years ago. I think now my knee cannot.
Affects now.
Yeah, cannot kneel because of that. I'm trying to unwind it, but let me work on it. Theoretically it can be done. Yeah, but because of that, I kind of respect. How come a lot of women are more flexible than me? Kind of thing. But likewise, I think they cannot do the heavy lifting lah.
True lah. I mean, you can get assisted like we say, you just do negatives and stuff like that.
Assistance.
Focus on body weight first, correct or not? In terms of exercising.
Like for example, I lost my pull-up competency, so I have to go and look for devices that I can, do my pull-up kind of thing. This is my current preoccupation. I'm looking for pulling things.
Oh, okay. Actually, you can use assisted bands or like the traditional way in secondary school, primary school, all they do the
eccentric,
the what you call incline pull-ups first.
But I find that one is like the mid back rather than upper back or something like that. I'm trying to design.
Can also.
I mean the mid and the lower back you can do rolling, right? Mid back you can do rolls, right? Low back is when you do deadlift, right? But the upper back, the upper one, I'm looking for devices there because the rings still body weight.
Rings, yeah.
I can't do a lot of reps.
Correct. I mean depends on our.
But recently I discovered the mid row.
Mid row is short.
Quite good.
Very short.
Can swap the bicep.
Yes.
This one is the men's stock.
Yeah. Suddenly, the girls are zoning out.
Go to Pilates.
Yeah, but Pilates, I think most of the machine. I guess you're paying for the devices, the machines, right?
Yeah.
I think it's okay because it's culture. It's like so you must respect. They always like it's always Zumba, line dancing, Pilates, yoga kind of thing. So I think it's kind of fit their body type kind of thing. And it's almost at the cultural level already. So sometimes we have to analyze from their point of view,
I mean, there's one thing also that they say, as long as the exercise is something that's sustainable for you, something you like, that you can keep going over and over again, that's the best exercise for you. That's what they say.
That's correct at the first level lah. Like for example, I'm an old school, right? Old school is the Lee Kuan Yew style, is the jog and the push up thing. Long time ago, just jog, swim and push up,
nothing,
right?
no device, nothing.
But nowadays with modern science, we realize that core mobility, upper body kind of it's become a bit more scientific and clinical. So the advanced level is you have to go into sports science lah, and it's quite democratized already. So it's not exclusive to trainers or professionals. Actually, you can go a bit deeper. But first thing is you get on first lah. You get on with level 1. You can start with Pilates, yoga, all that stuff. But eventually you have to go into the science. Then you start to check box yourself. Where am I short?
Francan, how do you maintain your weight? Cardio. What kind of cardio? This one cardio from Francan lah. I scared to know his answer. To be honest.
Classified cardio.
Specialized one. What kind of movements?
I train my arm and my feet and my cardio, my
Stamina. So how long you do?
30 minutes.
30 minutes.
Cycle.
Do you have a training partner to do?
I'll show you next time.
You guy or girl?
Both.
Then when you train,
What are you thinking of?
cardio running.
Nearby my house.
Francan is a decent man now, okay?
A changed
Don't
man.
insinuate, okay?
What are you thinking of? What is you what? How many asking exercise questions?
Not offended, right? He doesn't look offended.
Exercise questions. Yeah, well, last time you said about the diet thing. Do you still maintain dieting or something? Yeah, just to lose weight.
I think you need to diet on me.
I know I need to diet. I'm still trying. But are you still maintaining or not?
No, I just eat whatever I want.
Wow, this kind of people nowadays.
When's the last time you did a house cleaning? It was 2 months ago, was it? 3 months ago, right? You did some, right?
I think 6 months already.
6 months, yeah. Wow. Yeah, me too. Yeah.
Mine still need to know.
Yeah.
Poke each other.
Yeah. Last time we poked each other was like I think 12 months ago, right?
You got do a
You can exercise.
Yeah, after we broke up, I think.
You can exercise.
Yeah.
the house cleaning also. Actually, all of us also got do in the cleaning, right? Reny got do or not?
Yeah.
Yeah, we all have,
Done,
right?
okay. How was your reading?
How?
Okay lah.
Okay lah. Got
I
any?
just do just to see my liver.
Oh, you didn't do the whole thing lah.
I mean, I did lah. I did.
About only on liver that
I
you're
mean, I
concerned
focus
about.
on my liver because I was taking Accutane at that time.
Oh, Accutane.
yeah.
Yes, yes.
Accutane is for
Acne.
Oil glands,
right?
yeah.
What have you taken before?
I take
I
it.
finished it.
Hey, look very good, huh?
So who prescribed? Dr. Lai prescribed for
Dr.
you.
Lai.
Yeah, so for those who don't know, actually there's a treatment for acne and that Dr. Lai will prescribe Accutane. So this one basically, I don't know, maybe Dr. Lai can explain how does it work lah.
Accutane is a very old medicine. Chemically, is related to, very similar to vitamin A. So I always liken it to a super potent version of vitamin A lah. And then at the ultra potent level, they is used to treat psoriasis, even promyelocytic leukemia.
Okay.
Okay, so that's this whole class of Accutane medicine. Can't remember the generic name. Yeah. So, but at the so-called lower level, we actually use it to treat acne lah. Then what's the similarity? The theory is that it enhance maturation of the cells, enhance the cell cycle. So in effect, the oil gland becomes smaller and smaller. It renew the cell cycle faster. Yeah.
Okay.
So it takes about at very low dose. So dose means safe lah, right? Less side effect, minimal risk. So you take it low, about 6 weeks, you'll see the oil gland kind of shrivel down. So no oil gland, no problem lor, so to speak.
For your takes 6 weeks also?
I took for 6 months.
6 months.
6 months is that when you start to improve already, then you want to do kind of maintenance strategy. Yeah, keep it small lah. Yeah, keep it small. Let's say if you stop the medicine, as per normal, because the medicine that's about what all the medicine does. If you stop the medicine, the physiology of driving the oil gland will come back.
Yeah.
Yeah, so which will maybe 3 months, 6 months later, you see the oil gland come back again. So of course, the main driver for your acne a lot of time for young people is stress hormone and sex hormone, your cycles kind of stuff. Right? As you grow older, all these hormones will come down, and then you get cured, right? Yeah. So which means that if you for people who do maintenance, they will go very very low to keep the oil gland a little bit, manage size along the way long. So that's how I do it.
Yeah, for yourself, how long?
I took one box.
One
Which
box
is
is how long?
30 taps,
30 taps. And that's all? It works?
Yeah.
This is so different one person can take 6 months with maintenance, then one person take one box.
It's like,
Depends lah.
you go for weight loss medicine, after you lose the weight, then what next? It's really maintenance and preventive strategy.
Okay. So how would you recommend how bad the acne is, then you would start for them?
The typical justification is that you fail everything wrong. You fail your own treatment, over the counter treatments.
Quite topical on this.
Yeah, then antibiotic therapy, it works, but because you only address the inflammation and the infective part, so you never address the hormonal part nor the oil gland size, right? I mean, if you want to address the hormone part and the stress part, of course you try to de-stress yourself. That's social management, right? Then the hormone part is weight loss and all that stuff, weight management. But these are harder to achieve. Typically for young people, a lot of times the exam time, you get a flare, menses time, typically, and then the food binge, you go and eat all the mala, all those things.
Later we're gonna talk about that.
So you do all that stuff, and then you still look quite messed up, on balance, especially if it's very inflammatory and very scarring. The more pussy, the bigger the oil gland is, more scarring. So technically speaking, that's the justification to execute the Accutane.
I think that's the main thing that girls are afraid of lah. They don't want their face to get scarring, all this.
Yeah, the main thing is whether are you chemical phobic or not. Yeah, I mean there are people who are very scared of taking medicine. Then the general reminder is don't get pregnant lah.
Yeah.
Because the medicine has 1 in 4 chance
Don't get
of
pregnant lah.
teratogenicity. At least for 6 months of medicine. Yeah.
So for y'all, since y'all taken, what's your driver? Is it really just the scarring thing is your driver to start the medication?
For me, cause my doctor prescribed me doxycycline for 3 months. Then it didn't work, so I had to see her again. Then she finally prescribed me Accutane.
So you see other doctors outside instead of Etern.
This was before I joined. Guys. Before I joined.
Are you going to switch over
Switch what?
to Etern?
Switch it over.
I really hear her.
The other one is
Yeah. Why does she
I
not
finished my
Can see
meds
Dr.
already.
Saifu ma.
I finished my 6 months already.
So you finished before you come over? Or were you taking here?
I mean, I was on my 5th month when I first joined here.
It was very bad because of
Okay.
Cystic
on hindsight.
acne.
Oh, quite bad.
Yeah, it was at like my jaw area.
But how come?
Yeah.
What was the
Stress or what
social,
just now mentioned?
Any idea?
No stress, no nothing.
No stress?
Exam? Were you taking exam that time?
No, like no diet change, no stress, no nothing. Just suddenly, I had a lot of pimples.
burst out, yeah.
Yeah. Nah, I thought it was just hormones change.
There must always be
Puberty thing?
huh?
Puberty thing?
I thought it was a puberty thing because
Ah.
I saw people say online like women get second puberty.
Is it really a thing?
Yes. I mean, hormones can.
It can just go away on its own kind of thing.
But the classical is school exams. School exams.
After meeting.
Okay lah.
Would you recommend other people to start Accutane?
Or doxycycline.
Or to see us.
Oh.
So many questions.
You choose which one you want to answer.
Accutane depends. Actually, I quite suffer a lot of the side effects.
How many capsules were you taking per week?
Two capsules a day.
2 capsules a day. Wow. See,
Wow.
how much did
I
Dr. Lai prescribe?
Doxycycline or what? Or
Accutane.
Accutane?
Accutane.
Oh.
Ah.
Two.
Yeah, I think 1 to 2 per week. Dr. Lai prescribe.
Dr. Lai is
See,
the
different
monk.
doctor,
Yeah.
different
Monk.
style also.
Sorry.
Kiasu doctor. Gentle.
But
also
then you
like-
see 1 month only. But
It's
okay,
a bit slow
different
lah.
individuals lah.
The light touch method is a bit slow. Because the first 4 weeks, he probably he's thinking, hey, it was Ikiabo. Dr. Lai is still like that, we're still like that. Yeah. But actually, one question is, how was you guys your psychological? How do you feel that the acne is affecting you in terms of your confidence and kind of thing?
Yes,
Upon 10, what's your score?
I think 6
6, that's quite bad. How about you?
6 confidence.
How did the acne affected you?
Okay.
How bad? On a scale of 10.
Yeah.
8, huh? Wow,
Yeah.
it happened to me also like last time when I was your age. Also acne. Yeah.
Then I
So I
couldn't
feel
hide
very
with
bad.
makeup.
Yeah, I
anything.
cannot. Very hard.
It was very great.
Mine got boys one last time in university. Yeah, boy.
The rate is pain, right?
Yeah.
I feel a bit depressed,
Lucky, yeah.
like a bit hopeless, socially speaking. Yeah, a bit, I think it's psychologically damaging in terms of your long-term self-esteem. Yeah, short-term, of course, you pass your don't know what test, you get on with it, you think you're okay, but long-term wise, it seems to have impacted your long-term.
So now you're working here already, not so bad already lah. Does it like rebound or anything?
Hopefully not.
Hopefully not lah. Are you still taking?
I finished
For maintenance don't have?
No, don't have.
Lah, so there's no stress lah working over here.
How many months have you stopped? Your Accutane?
Oh, good question.
2 years?
I stopped last year September.
Until now.
Yeah.
That means the company is good.
Good life working here, no. Guys, you got 2 example lah. This one not planned lah.
It's good for it.
Then it. Why you?
I didn't get the joke.
Good boss.
Oh, good,
Got good boss.
Actually, I got one interesting question. Transportation. Were you transportationally compromised last year? Like you travel long distance?
To
Your
work.
school, your work, stuff. Last year, the last one, the cystic acne.
Oh, during the
Long
acne,
distance also is a bit tiring.
Yes, because that time like COVID period, they wear mask.
Ah.
Yeah.
Oh, good point.
For me, I had to travel quite far to my school, but
Oh.
I feel like no effect leh.
You don't think so, but correlate it with the coincidence. Cystic acne and the social
Is it
life.
coincidental?
The time were you transporting more, longer, stay back in school longer, that kind of thing, because of
No.
exam projects, that kind of stuff.
Because the first 2 years of my school, I had no acne. I mean, very little acne lah. But on my last year of school, towards the end, suddenly,
flare up.
yeah, flare up.
The last year of your school, right?
Yeah, but I didn't feel a lot of stress lah.
But last year is the most stressful one, right? Generally, yeah.
I'm not stressed.
Okay,
I
guys.
wasn't stressed.
But a lot of people, I'm not stressed. I'm stressed. The one lump here, one lump here. No, BP go up. I don't I'm not stressed. I also see this kind of patient. Yeah.
Just now you asked transport, right? She stay very near only. It's a little
But
more.
the school, the school.
Yeah, the school.
No, school far lah.
Yeah.
That's why.
But
This one also.
last year you got project work. Last year of the academic, right? Project work, all that stuff. Usually you think anyhow guess also you spend more time on there one. late nights lah, all those things.
Oh, that's true also. Your sleep will affect or your hormones.
Correct. Yeah. Do you pass 2 o'clock or not?
This one I think I know. These two will sleep very late.
Sometimes it's not the work. Sometimes it's not the work. It's the after work, your mental health. You don't want to have some fun, right? Then you push on.
True.
Yeah.
It's like you feel you work so much, right? Then you go back. I need my own time.
You have to count that in as well.
Correct. I think that's the work life general. I think working in Singapore also, you work long hours also is like the norm.
Same here.
I think OT also everything. Then
but physiologically speaking, after 1 o'clock, there's a point that you will get a trigger off. How do you detect it? Your face become more oily. There's a point, I saw it 12 a.m., 12:30, 1 a.m. or that, you see your face suddenly become oily. Next time you go do an experiment, you just observe. Let's say you play game or watch TV. You find past a certain point, you become a bit more oily. I think the hormone just surge a bit. That's what I noticed.
There's a body clock component.
It's supposed to go down, but kind of you force it up.
Oh, very interesting.
Recently, I'm doing some study on this, the resting metabolic rate. So I was reading a bit. We have a sinusoid pattern, right? The nidus and the peak happens from 4 a.m. to 6 a.m. and 4 p.m. to 6 p.m. Our peak metabolism is from 4 to 6 p.m. Our trough is 4 to 6 a.m.
I cannot visualize. I think need post edit. Need to. Okay.
So, but when you're doing all this thing, you will upset this cycle. Yeah. So let me go and read a bit more so that we got the machine to measure. But how do we use it to profile patients? It takes a while to study.
Interesting. So people like working night shift, all this.
Definitely, something wrong with. It's an interesting topic. Yeah, it's like as primary care, how do we design health screening packages, right, to profile this group of people? Not so straightforward. The simpler one, you go and Google AI, all that stuff. Most likely they will ask you to check cortisol,
Low cortisol.
but I find cortisol very difficult. But thyroid free T4 actually has a range. Your free T4, if it's less than 15, usually it suggests that you got this kind of problem. And I noticed hypothyroid is less than 12, but between 12 to 15, this group of people, they have this kind of nightlife issue.
Actually, speaking of nightlife issue, I think Francan has actually curated our health screening, one of it, more to like the youngsters, right? Previously, you have the original old school health screening. We have our from A to E, right?
Yes.
We have A to D. Then now even A has been removed. Then you just brought out this topic. Actually, I don't know. Of course, I think Francan, you have like a very because master phlebotomist thing. He has a very good knowledge about all the.
He used to work in the lab, I think.
He worked in the lab, is it? In the lab itself? Wow, this guy really all the way medical. You know secrets about him in this podcast. Very interesting.
He started working at 5 years old.
Probably. Just come out with the That's the only way to survive Singapore work culture. But how you come out with that? Like, I mean, for us, it has been a long time, many years, right? For your screening packages last time.
Yes.
Then Francan came in, introduced E and F.
Yes.
How do you come out with that? What's your thought process?
People like you, right? You need the package.
Your economics,
So for youngsters like us, right? So you go drink
You got a point.
So you check for fatty liver, everything.
Yes. Liver fibrosis profiling is designed by him.
Fatty liver.
Alcoholic liver. So the package works for.
So what's the test that specifically do for this?
So liver stat.
How do you know like
liver stat is this?
Liver stat is a combination of biomarkers that the source has designed and authenticated with liver fibrosis, right? I mean the mainstream liver fibrosis is an updated version of liver assessment, right? The classical liver function test is the blood one, right? ALT, AST and all that stuff. So you see the thing going up. But the thing is we realized that when you get liver elevation of enzyme, which group of them actually become worse. So they find that people who have fibrosis will do worse. Then how do you detect fibrosis? Either liver biopsy, which is very invasive, not viable, MRI, which is very expensive, quantitative ultrasound. The famous name is called FibroScan, right? Quantitative, we have quantitative bone ultrasound, but we don't have quantitative liver ultrasound. It quantitate. So then after a while, people find blood test markers that approximate all these tests validity. So you validate, and one of the commercialized service is liver stat. Basically I think it checks a bunch of biochemical
What is fibrosis?
hardening right? Then scarring, yeah, basically it's collagenization of your liver cells. Instead of having liver cells, you get a lot of collagens outgrowing the
Peanuts in the liver, right?
correct. Therefore, it's very hard lah.
Oh.
Yeah, it's very hard.
Okay.
Yeah, and then they find that people who are fibrotic, they got higher chance of liver failure, liver cancer.
But a lot of people say only those that drink will get this.
That's alcoholic liver syndrome is the classic, long time ago. But I think nowadays, we have this big group of people called fatty liver one. Fatty liver is almost like, I think 30% of us have it. Yeah, and this 30% we are not drinkers. And what's driving us? I like this theory of corn syrup. Yeah, the all the sugars that are in our soft drinks. Yeah, I like it. I like the theory, and I observe it in my patient. I remember that house clinic that we have a patient. She came in, her liver enzyme was 200. She drinks sugar drinks and all that stuff. So next year she came back all zero, and then she say she stopped drinking all the sugar drinks.
That's a good point, because now I also drink like slightly sweet.
Slightly sweet.
Slightly sweet.
You think about it. You talk to
No sugar. You check. You check. I don't believe.
if you read the chemical structure of alcohol, is by two carbon structure. Alcohol is made from fermentation of glucose. Glucose is six carbon structure. Through fermentation by the yeast chop, then the two carbon structure came out, and then it's ethanol, alcohol. So it's actually a glucose byproduct.
Okay,
then corn syrup is also another form of sugar. I think it's called sucrose, right? It's a disaccharide, then there's a glucose component and a fructose component.
Yes.
So that the theory is that this sucrose or fructose is bad for the liver. I like this theory. I mean, there are many theories for fatty liver.
So it's not like confirmed hard in stone in the medical literature yet, lah.
Oh, that's a good comment. If you talk about scientific evidence, you must really look at the politics of the study, because big budget, you get big data, the result is authoritative, the message is authoritative. But when it comes to smaller ones where there's no such political support, it might be true, but the database is not so big. So everybody asks so many questions. This fatty liver thing is not exactly the superstar of scientific pursuit.
Okay.
It is quite popular, but not the top one. Will be diabetes, cancer, right? So you don't get big population data, and then the statement that so this corn syrup theory is just one scientific message. So it kind of get lost, sometimes. So, but as a practitioner, a lot of time we just do our stuff and then see whether it works or not. And then it works, then probably it's real.
So what are the early symptoms of fatty liver? So for young people, they won't know, like they don't believe.
It's a good question. So there are 2 prongs to make people believe. You have symptoms, you got biochemical abnormalities, right? So if you got only one of them, you tend to be a bit not so convinced. For example, if your blood test is abnormal but you don't have symptoms, then you say, I'm okay, I don't feel anything, right? Then you got symptoms but the blood test is normal, maybe the symptom is due to something else. Maybe I'm anxiety or depressed. But if you got symptoms and then you got abnormal blood test, then you tend to be a bit more belief, right? So his question now is, what is the symptoms of liver dysfunction, right? If your liver is very engorged, your liver is on the right side. When it get engorged, you actually have pain, gastric pain, but the gastric pain tend to be on the right side or the epigastrium, not the left side. So typically it's after a fatty diet. So if you eat you can do this fatty diet challenge test. You go and eat mala, then if you got the epigastrium or right hypogastrium symptom, bloatedness, cramp or aches, think about your liver, and then you look at your liver function test. If it looks funny, then
Is the symptoms immediate? The pain?
Yes.
If you already have the
15 minutes
condition.
to 30 minutes. How do you know that? Back to GP. You have dengue fever. Dengue fever is hepatitis. Dengue fever is dengue virus actually that
I don't know.
interesting. So dengue fever, actually the dengue virus infests the liver. So a lot of time dengue patients, when you do their liver function test, a lot of times it's 200, 300, that kind of thing, right? So sometimes you ask them, they do have this abdominal pain and they have diarrhea, they have nausea, they have vomiting, they got bitter taste, can't taste anything. Actually, all these symptoms are, as a clinician, I think is actually can be attributed to liver dysfunctionality. So that is a good example, right? Gastroenteritis, some of the viruses also can affect the liver. So from your cough and cold segment, you can see the symptoms of liver dysfunction, right? Then at the bit more at the bit more downhill level is malabsorption because the liver actually is involved in digestion. So if you've got liver dysfunction, you can have these loose stools, muddy stools. Yeah, because it's mild digestion, not frank diarrhea. Yeah, as symptoms of. For example, if you are interested, this one we see that in the clinic quite often. Monday coming, I got doctor, I got diarrhea, I need MC. But you go and ask question. Actually Friday, Saturday they went to binge.
Okay.
They basically they get the alcohol hantam the liver until then 48 hours
Friday
later.
night drink.
Yeah. So this pattern is quite common.
I always get diarrhea.
Voila. Yeah. So the body do speak to you, but patient they don't realize it. Only after a while then they realize that actually the body do talk to you. But it's just that are you listening to you?
So this Gen Z
Rashes
kind of
also.
diet, will it like worsen the fatty liver nowadays?
Definitely, yeah.
What do
We
you
got
think?
Gen Z people coming for blood tests, quite messed up. Yeah.
I mean nowadays, I think what's the common food that you all always eat nowadays? Mala,
fried
everything, fried food, all the fast food lah. All this also fatty kind.
Very bad. It's only better than processed food. Actually, in my opinion, processed food is the worst. Then outside food is the second worst.
Yeah, all your char kway teow also.
Yeah,
you don't
yeah,
think
yeah.
people think like it's just fast food that's bad. Then you eat out
Because
like,
the
hawkers
hawkers, the motivation is to seduce you, man. Wow, sedap.
soy sauce, all this.
It's a form of addiction.
High sodium diet also.
Yeah, it's to feed your addiction.
True lah. They want to make us keep coming back. What?
I mean, from the commercial angle, you understand. Yeah. My son is like that. He was a teenager, overconfident, right? So we challenged him, made him do the stool test. Then he realized, his body is a bit messed up already. Yeah.
So when he was eating anyhow lah, is it?
He was into processed food, nuggets, and Wingstop.
Oh, okay. Actually, I also like Wingstop lah.
What wing is that? No, what wing?
Wingstop. All the boneless wings. The ranch.
That one quite sedap. Damn sedap.
Yeah, true.
Why he buy 4-5 boxes?
Oh.
He skip one meal, skip 2 meals just to go and buy the thing.
I mean the ranch itself is actually
Yeah.
sinful.
Extra ranch some more.
Yeah.
Then drink the whole thing.
I cannot.
So sometimes you can only stop this kind of behavior with evidence.
True lah.
Evidence, yeah.
That's why you need the health screening. That's the whole point.
Interesting thing is that as a teenage, a lot of them are needle phobic. So he hasn't done any blood test yet, But there was this stool test that's available. Then I put him through the stool test. It turned out to be quite educational. Yeah.
So stool test doesn't use any blood at all, just
Correct.
purely the stool test. And then what does it show for
His microbiome is a bit haywire.
the gut health lah?
Yeah.
So like literally what you eat will affect like who you
Yeah,
are. Like
yeah.
you are what you eat. That's what they
Yeah.
say. Like the old saying goes.
It's just that sometimes no evidence, people don't believe. It was quite educational. Even the rest of the family, we did the stool test. The best stool profile, you know who? My mother, the grandmother.
Oh.
You know why grandmother do the best? Because my mother cook primitive food.
Oh.
You just put what, cook the steam, boil,
the
and then
steam
put a bit of
food like
salt
that.
and pepper.
Wow.
The kind of food that you all don't want to eat.
Yeah.
Primitive
Tofu
food.
lah.
It's called whole
like
food.
that.
Is it? It's called whole food.
Whole food
No
different
oyster
a bit.
sauce, no soya sauce.
Whole food more the angmoh tom lah.
Whole food.
Because angmoh diet is like cheap, it's just fast food. Then outside you eat like all the restaurant kind. Then whole food, because they don't really cook much at home. Then it's like you go to buy actual groceries,
Yes,
like
yes.
real food.
Yes.
That's why they call it as whole food, like that.
Yeah,
Yeah.
my
So
mother-
technically they don't really use it for Asian dining, but I think you can say so lah.
Like the
It is like a
tapioca,
safe
steam
food.
the tapioca, then chop.
Yeah, very basic like that.
Salt and pepper.
Actually during the fasting one, actually just eat sweet potato, that kind of thing. Then tofu,
Whole food lah,
very plain, yeah.
Versus processed food.
Processed food, that's
you
right,
cannot
correct.
processed food. You can't see the shape. Whole food, you can see the shape.
Correct. Alright, we have a section for Dr. Lai to react on this Gen Z trend. So our producer here has actually come out with a few videos that we are going to react on.
Okay,
Actually, full disclosure, I also haven't seen so I don't know what is it about. Okay, so let's take a look at the first video first. Dr. Lai, can see?
Is it the one with the exercise one? Yeah, the one exercise one, right? Okay, let's try. So people exercising it. Bit less than 1,000 Chinese fat prison. Yeah, like prison camp. Useful.
Oh, what is
You pay
fat prison?
But they pay 1K to lose weight.
Oh, is it, so you're paying to
Lose
to
weight.
suffer,
It's like our BMT lah.
Oh.
and that one at least you get paid, BNT.
The first step, my response is the first step is the hardest. And
But-
sometimes paying some money for it will make you more committed to it, ma.
True, you don't want to waste.
Yeah.
You don't want to waste.
Like my son, for example, when he rebelled during his adolescent age, right, from structured, he refused to exercise anymore. I mean, he was,
Wow.
so then he, of course, a bit unhealthy, getting a bit fat, all that stuff, and we have been whispering for many years. I think he rebelled at adolescent was like P5, and until after O level,
Yeah.
that's a good 4 5 years that he kind of like not very exercisey kind of thing. But after O level, there's this personal trainer, professional, quite expensive. Actually, not that expensive, right? Because the more expensive one is gym membership, right? $3,000, $4,000 or something like that.
No.
Okay, I know you got a point there. Marthius got his own angle, which is quite. but as a adolescent kind of thingy, so sometimes you need to like give them a more packaged, structured, plug and play kind of proposition.
Okay.
So somehow he bite, because after O level, no stress. Then there's this package thing, like professional, nearby, convenient. And then he went on. Then after that, he lost about I think 5 kilo or 6 kilo. And then he get on with it.
So like because of after O level, you mentioned no stress. There's like no challenge for him.
It's like as a parents, we got a chance to jump at it and push him for the first step lah. Yeah. So the attractiveness of the package and the timing was correct. Yeah. So I think to execute behavior change, you need the constellation of opportunity. The timing is important. The vendor, the so-called the package is important, and then the push is important, and then the net result is the first step. Because I think after that things are easier.
So for you have your first step also for taking your Pilates and you start running also. So how do you find like what's your driver to start the first step?
To be healthy.
Well, yeah, everyone knows like want to be healthy, but then they don't move. They still don't want.
How long did it take you to make that first step, and what are the constituents to it? Because there's a difference between haven't done it and done it. In smoking cessation model, we call it pre-contemplation, contemplation and action. The model as I think RN, you guys will learn change behavior, right? Yeah, this is an important concept. Yeah, the from pre-contemplation to contemplation to action is a mile away.
So,
and how to approximate that distance is based on techniques and opportunity and timing. That as a professional, so-called professional, we need to be very very detailed and very sensitive to the little details. So because when we sense the person is shifting, right, we need to jump at it, right? And sometimes you have to create that environment, like for example cholesterol test reporting. When the moment the person see the bad report, you might be able to shift them from pre-contemplation to action.
Okay, yeah.
Things like that.
They see something like, this scares me, then I start.
Correct. So for something more subtle,
was it like a scare driver or you want to go somewhere? Right?
or your friends?
Yeah, my friend asked me to go.
So you start exercising with them.
So
Correct.
social is important. Who you befriend is important.
Right.
You befriend a bum, then you become a bum.
Then partly also actually is your algorithm, I think. Okay, so I don't know, Dr. Lai, now we are in social media, your algorithm is like one of the most important things. So what it fits that you see also, right, will affect how much you do. Sometimes if you don't see all the fitness content, you just see mukbang, right? Wow, I tell you lah, I'm sure you just want to eat. But then for me lah, I see ever since you start like looking into fitness things, then all the fitness will come in, motivate you also to go. So I don't know for them lah, but for me, I want to lose weight also. The other time is like to
Your first step, you're talking about your
my
first step.
my first step is actually breakup. So like the other time our relationship was like start like okay, so long already then complacent then you start eating a lot, then you gain weight. Then after that breakup, you want to revenge lah. Revenge. But you want to be like revenge by being the better ex. So you actually want to work out lah. So want to work out, then last time all I started was like every time I see a pull up bar, just do pull up.
Was there any friends involved, social friends, like, hey, let's go to the gym, that kind of thing?
Not really. It's
So
just a
that-
personal revenge feeling thing.
Does that apply between? Is this the difference between men and women?
Good question.
Woman is more social driven.
Yeah, I feel like
Your Pilates, what's your
I mean, Pilates is
what's
because of
your
friends lah.
friends, right?
That time you go was with the Etern staff also, is it?
me, her, and Cindy.
Wow.
See,
Etern staff,
Etern promote
wow.
healthy
So proud.
lifestyle.
So proud.
Three fat people.
You fat man?
Because-
Not fat.
Call this fat man.
What's your BMI?
23.
18, 19?
Wow. Almost osteoporotic.
Actually, another thing about bodybuilding, also BMI a bit pointless.
Yes.
Because you have muscle mass, it counts. So we don't really look at it. We look at body fat percentage, which I'm still not there yet, lah. But
You can tell.
I'm still 24%, 24%. I aim to go like 20%.
Wow.
Yeah.
It's just a number. you know.
Yeah.
It's just a number.
True.
Just only 45%.
Wow, 45 Actually, up to
I think I'm 29%. 29 or
at this level, I don't know.
29
I don't know.
or
Above 30, I cannot. I
men,
cannot
men
guess.
is less than, supposed to be less than 20.
But for women, in terms of the fat percentage, they cannot go a certain level lower than men. Like we can go like
Their norm is
5%.
30%.
Can
Oh.
yeah, they cannot below like 12%. Simply
Yeah.
because of the women hold more I think the internal body fat or something.
Health
like that.
screening, we see
Not the external.
anorexia nervosa profile. And you know what's the thing? Those anorexic ones, their
Yeah.
BMI is 17. They can have a paradoxical hyperlipidemia. Cholesterol goes up, you know. Yeah.
Oh, because of the anorexia.
Yeah.
Yeah.
Well, somehow culturally, most women, anorexic profile tend to happen in women. Majority is women.
But you said she's not 17 lah.
Yeah, 70.
She was 8. She said she 18.
I mean,
Come on,
so how do you differentiate healthy or unhealthy biochemical profile? Yeah.
Oh.
So if your profile is healthy, then I suppose you are healthy 17, or if you are holding haywire, then you are not a healthy 17. Yeah, because young people, maybe your BMI is a little bit. Even from a BMI point of view, you can check the teenagers or that stuff. The BMI is not exactly the adult range kind of thing.
Like what you say, BMI is just a number lah.
Yeah.
That time I saw one of the patient, I draw blood also. He was skinny, but then the cholesterol high. Then I got another patient,
Yeah.
very fat one, but perfect. The
Yeah.
HS screening
Yeah,
perfect.
correct,
Nothing highlighted, nothing. I was like, completely different expectations lah. So you could be skinny, but not necessarily healthy
Correct.
So BMI is just a number. Okay, you can take a look at the next video. I think I haven't seen this before.
Why are Chinese Gen Zs lying face down on the ground? If you're in China right now, you'll see Gen Zs sunbathing on the rooftop, at the park, or on the balcony. Every inch of their skin is covered up, except their backs. This is because starting on July 15th, we've entered Sanfutian, aka the golden treatment period in traditional Chinese medicine, lasting for 40 days. This is the optimal period for growth, and for humans, the best time to improve our physiological functions. For only 20 minutes a day, sunbathing your back is associated with benefits like increased blood circulation, strengthened immune functions, expel wetness and chillness in your body, slow down aging, improve sleep quality, and reduce the chances of winter illness. Girls said they feel their periods have become more regular and experience fewer cramps. Some saw their facial skin has become smoother and tighter, with less breakouts and wrinkles and rosier cheeks. A blogger is sunbathing with her dog. Another joked, the way your hands and feet are positioned made this look like a crime scene of a victim with her baguette. A girl was sunbathing at the plaza of her residential community, and someone took the photo and posted in the residents group chat. Her parents told her to go home because she looks like a corpse and it's embarrassing for the family. Another joke, you need to wiggle your fingers and toes, otherwise some random stranger may call the police for you.
Oh my god.
This one is my response is vitamin D.
That's what I
Vitamin
think
D,
also,
vitamin
vitamin
D competency.
But it says what golden what treatment, all this. How is it really?
In a temperate country, they got winter, no sun, that kind of thing. So I think when spring came out, then they get a sun. I think they are talking about that way.
I think it's mostly because Gen Zs like to stay indoors a lot.
Yes.
Then
yes.
always use your phone, all this.
Yes,
Do you think like Singaporeans
Definitely.
actually?
Well, when we do health screening, the vitamin D insufficiency is about maybe
Well,
10,
vitamin
10%.
D. Vitamin D, is it very white? Is vitamin D low or anemia low? Is it? If you look very pale, very.
You look very pale, can be low blood pressure, anemia. Yeah.
Oh.
Yeah. But your skin type, your natural skin type,
Okay lah, the skin tone
Caucasian
is the
skin
one thing,
type,
yeah,
Oriental
yeah,
skin
definitely.
type, Hispanic skin type, and then the African skin type. That one actually affects your skin pigment. Actually affects your vitamin D absorption. You know.
True.
Yeah. So there's a norm. If you are skin type 1, like Caucasian skin, right, you just need to shine like 10 minutes, right? You get the activation.
You get a lot of vitamin D.
Yeah, because you know you don't have pigment to stop
Kind
the
of, yeah.
ultraviolet from activating of vitamin. But if you are skin type like the pigment African type one, typically in the local culture, Indians have very high risk, much higher risk of vitamin D deficiency and higher risk of severe vitamin D deficiency.
So it's true lah. What the trend is saying.
Yes. And then vitamin D is they call it immunomodulating. So the standard understanding is for most of us is bone health.
Yeah.
But there's immunomodulating function of vitamin D. It's actually been used for some disimmunity conditions like psoriasis and all that stuff. Yeah. So all the rheumatological conditions, they actually also focus on vitamin D adequacy. I won't say it's the main mechanism, right? It is a well-established component of rheumatological practice, but at the general practice, family medicine practice, is mainly bone health that we see. Those that has very low vitamin D, sooner or later they will get bone, joint, muscle, tendon issues as early as 35 years old. You know, aches and pain, sprain. You know, so why you're so soft, that kind of thing. And the social part is, you got a point lah. It's like because of global warming, most of us are hiding in the aircon room.
Correct.
Yeah.
I think
So
bone
we
health
get
is
the
also
activation.
important, especially for old age. I think Gen Zs tend to underestimate their bone strength.
Yeah.
I mean, as I study gym, fitness, all this also, we know like the more you strengthen your muscle will basically protect your bones, all this. So we really learn how to have a longer lifestyle.
Yeah.
I think Gen Zs need to invest in their health for their own lifestyle.
And it's very subtle because you know, you want to wait until you get the report that your joints are a little bit degenerated, you know, like grade 1 arthritis, or see your bone density, you know, like reported as abnormal, you know. But what is before that? How do you assess your bone health before that? Not easy. I think bone quantitative bone analysis is probably the most exacting one. Yeah, it can be used with X-ray, DEXA scan, or ultrasound.
The bone QUS that we have.
Bone quantitative ultrasound. The He one is quite corroborates with the X-ray version, DEXA BMD, bone density spectrometry. I think that one is good because it doesn't hurt and it's quite affordable to assess bone density lah. Yeah. Once again, is to authenticate so that you know where you are, right? Another one which is more convenient is just check your vitamin D level.
So
Majority 70% will be low, then 10% will be very, very low.
So you think like people should actually more often than not actually check the vitamin D levels?
The Francan's the updated version,
correct.
for the young people.
His new health screening version,
his pet packages
actually have that, because I think the component that he removed was actually the
stool test, I think.
The stool, right? Yeah, because I think the basic stool test, like I think it's just occult stool,
Occult,
right?
which is more applicable to older people.
Yeah, older people. So for the younger people, we don't really want to do all that kind of stool test. Different from the one that you mentioned for your son. That one was a more in-depth microbiome one.
Correct.
But the occult stool test is just
for the
more like
colon
cancer or that,
yeah.
which also relatively for younger people not
Less
that
common,
relevant, right? Yeah, I think that's why he include the liver stat, the nutritional panel. I think that one is much more like
The
forward thinking
younger
kind. Yeah, acting. So I think this is literally just one of the trends that people see lah. So it's interesting to know that actually some of it actually works. So Gen Zs they're probably cooking something lah, and their medical health probably once the Gen Zs become doctor probably completely different.
They call it heliotherapy.
Heliotherapy.
Helio means sun. Heliotherapy.
Yeah.
Alternative medicine, they call it heliotherapy. In the National Skin Center, it's called phototherapy.
Phototherapy.
Where they use filter to make the light therapy more precise. Narrow band, they call it narrow band.
So like no
ultraviolet
UV.
ABC. Narrow band UVB is the purported is supposed to be the most therapeutically useful one.
One counter to this, right? People mentioned got skin cancer from UV rays or this. So how?
That's why they got this narrow band. So it doesn't cause so much photo injury to and then you get photomodulating. Skin Center was very into all this kind of phototherapy thing.
So Singapore Health have advanced to take all this into consideration, so lah. The phototherapy
is not new. Just I think the peak was laser therapy, and then now it has become mainstream. You do IPL to do your hair removal.
So this one high sweetness also increase. So you just see before break, don't have suddenly pop up here.
Sponsor, who's
That's
sponsored? Delphi. Sponsored by Delphi.
Okay, next video.
Next one.
Let's see what is this about.
我跟你讲，很神奇的事情，因为我每天都会测体重嘛。我有一天晚上不吃，但是我吃了反而第二天减的会多啊？为什么？为什么，老师？
这就叫睡觉减肥法啊！因为优质的睡眠会让在睡觉的过程中身体继续代谢。晚餐不好好吃饭的话，你在睡觉的过程中代谢会下降。
TEF. It's called TEF. Thermogenic effect of food.
I do study that a little bit in terms of nutritional diet for GWing. So, but I don't think it's that much effect. Correct or not?
I suppose if you sleep in starvation, you're starving, and then it keeps signaling to you that you're hungry. That's the main message here, right?
I don't know. It just says that you sleep then you lose weight.
I
don't know. Maybe you can ask the skinnier people here.
TEF and
do you notice that?
No.
Francan, I think you say last time you eat then you lose weight. Yeah. I don't understand. How does it work? I eat, you are definitely gain weight.
But I gain weight in Etern.
So
because I got no time to sleep.
Is it a stress component also? Actually, sleeping sleeping also.
Stressful.
If you sleep health also is important, right?
Ghrelin. I think this appetite center. There's this hormone ghrelin. Whether you got enough sleep or not affects your ghrelin. Ghrelin is, I think, a hormone of satiety.
The only thing I know about sleeping is for me to gain muscle. Like if you sleep, then they will promote the muscle factor, muscle growth factor.
Then just now I told the cycle thing, the diurnal thing. It's not just resting metabolic, which is, there's this hormonal thing going on, right? So if you are disrupting it, then you will get the impairment of this. But in the uncle level, a lot of uncles pee 3-4 times at night. So you go and ask your parents. So their sleep quality is pretty messed up. Does it affect all this? What is deemed essential for our topic of interest, right? For example, gym recovery, this weight management. So this topic is a bit difficult.
Right. It sounds very very controversial.
But Health Promotion Board got 3 KPI. What? Your step count, your dietary, and then they put sleep as one of the KPIs. So sleep being a KPI, of index of health. Because, for example, mental health, your sleep quality and quantity is a good index of your mental health. I mean, basically, people with dementia and depression, they tend to have disrupted sleep. So that's for mental health. For uncle, will be the prostate dysfunction. More than that, I think that there's all this peeing at night kind of issues that's affecting the old people. So then for the Gen Z, so-called, is the social part.
I think that's the main part. Especially all the gaming at night, all these ML at night, all these.
Right.
This is what I personally feel, but I think it's really legit what we discussed earlier. Like you come home from work already, you already got nothing, like so stressed, then you still want your own time. If not, you don't feel like living. Correct. It's just a mental thing. I really think sleep itself is a whole big issue that being underlooked in the Singapore culture itself. The culture.
It's definitely a interesting side. We tend to sideline,
that's right. I think cannot.
It's a bit difficult to focus on it and see how to measure it. Because things like ghrelin, how we can't measure it, right? Cortisol. If you talk about measuring hormone, like what I say, I think the thyroid function, T4, follicular stimulating hormone, sometimes I notice.
So the hormone thyroid levels lah.
I try to look at the subtle difference between those people who don't sleep well. And then there is a bit of difference lah. Like testosterone, I think yeah, there's a range.
Speaking on the sleeping topic, right? What do you think of like sleep debt and then like recovering sleep? You miss sleep.
I think it's just like exercise, you whack, then after that you whack hard for the first 3 days, then you recover. I think it's still doable. It's like going for surgery, you lose a lot of blood, then after that you pop up, and then you're back to square one. I still think you can manage it sequentially. Yeah.
I think now also you see like Reny like looking like she's sleeping already. So how do you think working in Etern Medical, does your sleep affect a lot? I mean, Francan already say like he lost a lot of sleep.
I miss my boss.
You miss your boss?
The ex-boss of the current
current
what are you talking about?
Not enough sleep. Then you all as a part-timer, you think part-timer is okay? Part-timer is okay, that's why they're smiling. All our full-timers have
there's a catcher, guys, you're in service line. This is the life, Service line is 24/7, 24/7.
So one person MC, you need to cover.
Service line is like that one, but the good news is that service lines, we are like commandos like that, You are the front line, you are the most decorated fighters, soldiers of the.
But still underappreciated.
I think you know where you stand. I think frontliners are we have our robustness. It's like Dungeons and Dragons, we are fighters like that. We are not the magicians, we are the fighters.
Okay, let's take a look at the next one. Where is it?
Chinese Gen Zs have found an easy and cheap way to lose weight. That is to sing karaoke for hours. This blogger went to the KTV alone. After singing solo for 1.5 hours, she burned more than 400 calories. After singing for 3 hours straight, she burned a total of 781 calories. Another blogger used Fitbit and recorded 529 calories after singing for 77 minutes. This netizen burned more than 1,000 calories after singing for close to 5 hours. Singing is a form of aerobic. Even when seated, you are able to work out major muscle groups in your upper body. It has been estimated that for someone weighing at 60 kg, they can burn 2 calories for every minute of singing. Singing Celine Dion's My Heart Will Go On can burn 13.5 calories, and you can burn 16.4 calories for singing Gangnam Style. A netizen said they sang on an empty stomach for 3 hours and found out they're 1 kg lighter the next day. Someone said if your heart rate reaches a certain BPM, you can start burning calories. As an I person, every time I talk to someone, I'm losing weight. Someone suggested to I people, go out to the street and hit on strangers. It will make you pour sweat in the winter. Another netizen said this is like opening the door to a brand new world. Their local KTV costs less than $2 between 12 to 6 p.m. on weekdays. Bring your own water, and this is way cheaper than a gym membership.
This one is calories, right? So calories, the most authoritative way of measuring calorie is heat, measuring your temperature. So calorimeter measures temperature, but you have to go to a lab, go into a pool of water and all that stuff, they measure your temperature change. So then there's the next level of next best gold standard is indirect calorimeter, where they measure your oxygen consumption rate. So the most famous one is VO2 max. Now you cycle and then you see how much oxygen you can use, right? And then they calculate, because oxygen approximate the amount of glucose that you burn, that kind of thing. So that is the next gold standard level of measuring your metabolic rate. So while the guy do the VO2 max, the scientists also realize, the heartbeat goes to up and down kind of thing. So people try to match your heart rate, then all the heart rate stuff come out already, right? To match it with your O2, VO2. Right, VO2 max or VO2 level 1, level 2, level 3 or whatever, and then they find that beats per minute approximate, and then that's why all this digital watch came upon.
Do you think these devices are actually accurate?
If I tell you like that, obviously the heart rate, if you raise your heart rate to a certain level, how sure are you that you are burning that much of calories? So there's always more than that, then the heart rate, they will have an estimated formula to convert to the calorie. So it's a derived, and then now all this digital watch, they got they got like 100 calculus,
exactly,
yoga, walking, so rolling or something like that. Is it accurate? My view is no, I don't think so. I don't think it's that accurate, especially the non-mainstream one, like something like meditation or something like that. Because when I was doing my gym stuff, I go, wow, so easy, man.
Then
am I sleeping slimming down.
Correct.
So once again, you must get evidence lah.
Correct.
For example, are you slimming down? You know, like let's say you do gym for like 10 hours.
Yeah,
something
so you
yeah,
singing, for example, this video says singing can burn 1,000 calories. I don't know
yeah.
why I cannot hit 1,000 calories on the treadmill.
Yeah, so most likely they check the heart. You know, your heart rate goes about. You know, you shout, then after that your heart rate go be high. Then the heart rate by default formula.
The formula.
The calorie. So I think these are derived ones. So I don't think it's that so close to it lah.
Actually, I got talking about calorie, right? I got a quick question to y'all. I don't think y'all know the answer to this lah. But maybe Francan might know. I think Dr. Lai, you as a doctor probably definitely will know lah. This one. So you know when you eat, right? Physically, you know that thing will gain weight, right? Then if you lose weight, right? Where does the fat come out?
Where does the fat come out from?
Yeah. How do you lose weight, right? Physically, where does it go?
Urine.
Urine?
Or stool, man.
Stool? No.
Breath.
The fat, the actual fat when you're losing fat, right? Losing weight, the fat component. Where does it come out?
Sweat.
Sweat. Is that what you say?
Urine.
No, not urine.
Is it true? Breath?
Actually, okay, already got it right. Okay, but the more specific one is actually, so like what Dr. Lai said to measure the VO2, right? I think the one that I found out was it's actually carbon dioxide.
Correct.
Because when you burn down the fat component, if you look at the chemical structure,
It's all
you
carbon.
burn down, it's all carbon. So actually, that's why when you exercise, right, it's not like some people will say sweat, some people say like, it's your urine or that. It's actually carbon dioxide.
Yeah.
Because of all the carbon that they burn down, they will come out.
Yeah, and now as the carbon get broken off from the fatty acid chain,
Yes.
broken up, it releases all this electron energy.
That's why when you exercise, actually you breathe a lot more. It's actually to burn out the carbon.
So there's one famous prescription, zone 2. Zone 2 is fat burning because at that rate you tend to burn more fat. Yeah, whereas
Right.
I think zone 5 is you burn more glycogen or something like that.
Yeah, so how, Dr. Lai, what do you think of Gen Z trends these days? Are they legitimate? Are they cooking? Are they onto
I
something?
think it's like my immediate response is like the economists, they call it K-shaped economy.
Okay.
I don't know whether you know K-shaped economy. K-shaped economy, the people who are doing well, they will do very well in these tumultuous times. Then those people who don't do well, they will sack until they are very suffering.
True.
Like for example, old economy, you know, they will go very bad. The digital economy, they'll do very well. So I think Gen Z they might go to the same trend. You know, those who give up, they'll have very bad lifestyles. Yeah. Whereas those that keep up with the tempo, I think they will do even better than Uncle Lai here. Yeah, they will do better because they are more empowered. They got information, they got parental support. Even companies, you know, are more humane nowadays. Right? Even the government is supporting everybody better than the past. So all you need to do is to step it up. Yeah.
So now is a chance, Dr. Lai, you have your staff, the Gen Z, the younger generation. You got any questions you want to ask the Gen Zs now?
You want to marry a robot or you want to marry a robot? People like Francan. You prefer Francan or robot?
Francan or robot?
MCQ only two choice. Francan or robot? No third choice. Okay, either Francan
No
or
other
robot.
guy.
Okay, let's start with Xin Yi. Francan or robot?
No, your boyfriend knows it's just a podcast. Francan.
Okay. Alright.
Human feeling.
Oh, human feeling good. Ina?
Really?
Human lah.
Human, not Francan. Yeah, I think nowadays there's a trend also. I think there was some, I don't know, China or Japan lady that marry an actual robot. Hologram on this. I don't know what this answers. Technically,
Quite scary.
theoretically you could you could craft your own boyfriend. Imagine if you could, whatever you tell your boyfriend, he will agree to you. Would you hypothetically? Would you prefer that?
This question is very cheap. You want to dig it's very
Exercising.
Fantasizing what?
You might want to go to classical psychology, the Carl Jung, the Sigmund Freud, developmental psychology. Whether can you overcome the pain of being together with another human being?
If you could say whatever you tell your boyfriend agree, would you prefer that boyfriend?
I want to rage bait.
I didn't get it.
Rage bait. So that means you want to like
Some banter.
annoy your partner or like make them angry.
Yeah.
So they don't want just puppy, what do you call it, a golden retriever boyfriend. They don't want that. They want like can fight one. I think this is just girl drama.
No lah,
it's more of like making fun
We
of
can
each
fight,
other, you
right?
know.
What?
Like making fun of each other.
Just play lah.
Healthy banter.
Yeah.
Okay. Healthy
Not
banter, I still can
toxic
agree.
way lah.
That's where you don't know where the line is. How you draw the line between
I find when the
toxic
baby
banter
comes out,
and-
things change.
Yeah.
Before that, still can have a lot of fun. Yeah. So there are a few gates that you have to overcome yourself.
So, any dating tips for these youngsters in love?
Oh, I don't settle for the first one. I think
Okay,
there's this teaching. You buy your laptop, you have to look for multiple models, right? For handphone, you also do your research, right? Then you buy property, you go first condo, you buy already.
So your current one, you have to how many times
About it's version 5. No, I'm not good at this thing, but but I remember this. My direct response is some guru say something like, you buy. How come you buy condo, you buy house? You just whack like that. You buy handphone, you check, do research. So the irony is that handphone only like a few $100s, but you buy condo very expensive. So then if you talk about spouse, it's even more jialat,
expensive in that sense.
Because you are supposed to be with this spouse for the rest of your life.
So do you regret buying your current spouse?
I explore homosexuality and robots. That's why the development psychology is. But this one is a very human philosophy. To be human is to suffer. Kind of thing. So human is full of suffering. So then you have to just keep going.
If there's no challenge, also it doesn't feel like life also lah. If everything's just okay, too easy for you, right? Humans will naturally find challenge also.
Yeah, itchy backside.
So is your current one making you suffer?
Yes, of course. Not really, but that's life. My son also now is a pain. What?
Tell your boss later.
They're my boss lah.
But I think YOLO, you only live once. Wherever you are, how painful it is, you only live once. So cherish it. I want open claw one.
Yeah, I think what you all think, because fun fact Dr. Lai, one of your staff here also first love, just now you say So what you think first?
Like that,
I'm Uncle Lai. My Uncle Lai advice very important.
Uncle Lai say first one cannot.
You can go one hour first before you go back. Don't sign contract first. I'm going to have 5 tenders first. I'm going to look for 5 tenders.
And to be fair, my dad advice like that also lah.
Yeah. You should.
So still can go back lah to the first one.
No, you have to tell each other.
So hope it's not all scared lah.
Tell each other that we go one round first, then.
Hey, what's this secret one? What's this secret?
Stop whispering so don't know what you're talking.
Yeah, I think now dating life market is also quite screwed already.
TFR is very low.
What's TFR?
Total fertility.
Yeah. That's true also. That is a Singapore issue.
No, it's the whole world. All the developed world is like that. So it's not our problem. It's the whole world's problem. The Gen Z, Gen Z is an issue. Wow, this one is tough. This question is tough because we are always seduced by robots. So it's a bit tough to. And the robot is so obliging, right? Not like the other guy. So
the verdict is clear lah. It's still humans still prefer humans.
When it comes to the crunch lah.
Humans still prefer humans. I still don't get why people would want to marry.
How about you? Human or robot?
Human definitely.
Human,
But I feel definitely human. But robots are there just to aid your life. You cannot just want people just to agree with you. But I feel like want to have a discussion. I feel like to have a common goal is important. But you need to have different perspective also.
That's a good point. Alignment. I like this word alignment.
Yeah.
So you must find that you guys have a good alignment. Yeah.
Some
culturally, psychologically, career-wise. Things like that.
But align more on the core value. Because some things cannot agree on everything. But your core value is the most important that you need to agree on. Some people just like, because we play ML together, okay, let's become boyfriend girlfriend.
That's the fun part.
Or we eat mala together, let's go girlfriend boyfriend. Or some for convenience, like they have been in school together. Then they're like, we always hang out together. Okay, let's be boyfriend girlfriend. But when it comes to marriage, suddenly, this person very bad, this person very bad, cannot manage their emotion or cannot manage finances. Then boom, everything. So it's more important to get the alignment core very well lah. So I think that's more on like a male side of things lah. So I think women's side of things is completely a lot different. I'm not so sure about that. What do you guys see when you want to find?
This topic is important because our TFR is very low.
That one's economical.
What does it
also
take
lah,
for you to go and sign the BTO? That kind of thing.
Wait, what's the question again? Sorry.
So what do you think from a woman perspective? Like what do you think in the dating life is important for a woman?
Or guy.
Or do you think it's the same thing?
Like in
Relationship lah.
Relationship general, or maybe is it a Gen Z thing that they don't care? I don't know.
Am I wrong or right to make a statement? Are you guys so superficial that fun is enough? Just fun, or then okay, it's okay,
No
we can
way.
be together. Or you guys are going into something a bit more deeper one. And if you are into the deeper one, what are the articulation of the deeper stuff you are looking at?
Wow.
Suddenly deep
Yes,
You're looking very deep into
What is your ambition in life? Do you have one? Gen Z, do you have ambition? Like get out of the house, right? To set up your own house, right? Suppose that one
Because
will
Dr.
be-
Lai mentioned a lot about he looks forward to like the Gen Z promise and the Gen Z's potential. Actually, previously we mentioned about how we talk about the Gen Z stuff that you're looking forward to and the future of the clinic and how Gen Z work life is also. Like not just your lifestyle, like dating is one of the things, but your career wise also. Dr. Lai actually mentioned a lot about like, the
Alignment,
potential
yeah.
and how your the mentality lah. What's your philosophy?
Because a long time ago, my generation, we were just led by Mr. Lee Kuan Yew. Lee Kuan Yew say, work hard,
Yeah.
study hard,
Then everyone
set
will
up
do
a
that.
family, get your HDB, and then you'll be well. And it turns out to be okay. Yeah, Singapore did pretty well. Yeah, but nowadays things are a little bit not so straightforward. But is it the same recipe? Will the same recipe guarantee your success? If you ask me, I think so. I think working hard is being ambitious and working very hard. It still will have show results. Because if you go to the penalty box long enough, you will score a goal. If you don't even go to the penalty box, you got no chance, right? If you stay at home, with 守株待兔 Chinese got that was saying there's this phrase this guy stay in the tree the first day got the rabbit ran into him, then he got free rabbit meat. But he got after that he wait for the next 30 days, no rabbit already. So if you stay at home and wait for the rabbit to come, I think you're just a sitting duck.
It's actually a very popular book called Who Moved My Cheese. Have you heard about it?
Correct.
Yeah, I don't know if this Gen Z actually read this kind of book lah. It's a financial book lah that talk about the mentality and how to find basically income lah. Either you want to sit there and then just because the cheese is there, aka your money, or you want to move ahead and find what's the next opportunity, or you just wait until it's gone then you go and find. So I don't know, you guys have your thought about your work life and your ambitions lah. Basically, that's Dr. Lai's asking you guys.
Like with my partner lah.
Not just your partner, in general, Gen Z as a whole, your whole life. Are you scared of the future or not?
obviously
Yes,
like I mean living in Singapore got a lot of things to
Yeah.
think about.
Yeah.
That's good. That's a good talk.
Like money,
Fantastic.
work-life balance.
Yeah.
Common phrase also from Gen Z, work-life balance.
I mean-
Just now you mentioned older people just work, right? Then your work-life balance.
There's some more relationship because
Yeah.
if both relationship working right, you guys must understand each other.
Must communicate also.
Yeah, because what if one shift work, one is office hours,
Very hard.
very hard.
That as an uncle, I can tell you, therein lies the relevance of the community. The village effect. That's why the importance of your parents, your relatives, your neighbors, even your work colleagues, like your workplace, because these are your community. Because if it's just a narrative of you and your husband and your kid, right, you'll get stuck.
True, correct. But it's still important to have like the family component. First, individual lah.
Yeah.
Individual component must be strong. Then you have the couple. Then you have family. And then you have community. Then we can have a whole nation as a whole lah.
But it's just that how do you
comes from the beginning.
the proportionate distribution.
Compromise
all
all
that.
Need to compromise with each other.
Working together,
Yeah.
everything.
And I think actually the good news is that I think this generation we are not so the patriarchal, yeah.
You
Because
do
hierarchical,
mention,
because Lee Kuan Yew's period, slap,
Very patriarchal concept, hierarchy-wise also.
the grandfather, you better listen to me, kind of thing. So I think that kind of
Authoritarian.
thing, authoritarianism is lack. So actually, it's a good opportunity for you guys to explore the community rather than be scared of it. Yeah, because your so-called in-laws might be more open-minded than you expected. Yeah.
I mean, now also you see there's more women also working in the fields also.
Yeah.
That's why you see like, and then there's like more of like gender blurring in terms of the workplace also.
Yeah.
Like you see like
House
we
husbands.
have guys inside, yeah, and you have house husband, you have guys working clinic. Last time there was a stereotype.
Correct.
Guys can only be doctor, then
correct.
girls only nurse. And also I think childcare sector also.
And nowadays
actually,
we got more women doctors as well.
Yeah, even we have
You know
women
why?
doctor.
Because during my time there was a quota against
Quota.
yeah, because they always think that the nation invested so much in MBBS, and then if the women, they will there's a higher propensity for them, the female doctors, to stop working as a doctor and then become a housewife when the kids pop up. I think that time they was having this worry lah, so they kind of like cow the enrollment to female. But nowadays this is not anymore, and then because of that there are more female doctors around. In fact, this generation, I think the female is a bit more than the male, because more the males are playing Minecraft.
Minecraft ML Mobile Legends too much
Mobile Legends. So we're getting more female doctors nowadays.
Yeah, I mean we have it in Punggol and Sumang. We have actually our own female doctors that are joined in with us more regularly. And I mean, good thing about female doctors is they can do all the HPV DNA.
Correct.
They can do all the women health thing. Because last time you want to do all the pap smear, all that.
Last time no female doctor.
Nobody want to come also because
now we got a lot of female doctors.
But only our clinic. There was this one controversy. The clinic assistant say, I send a message this pap smear blah blah blah. I don't know if you all see. Like let's say because they want to inform that it's a male doctor. But I think the language was like, this one male doctor. You sure or not you want to see like that? That it was very viral. But I think we can show how we send our own messages. I think there's a way to curate messages to be more gender sensitive as well in the way that we do. That one also curated by our ops manager. She's pretty good in making all these templates for our text. But I think back to the women topic, I think really having women doctor, more people come in for women's sexual health also, and they're more comfortable with female doctor. Even you want to go gynae also, you rather have like a male doctor or female doctor.
Female better.
Right, then if you want to talk about like the most common like menses cramp, I think if it's a male doctor, will just give you straightforward, but they have no empathy.
The empathy, correct.
No empathy part. Personally also, as a guy, I'll be like, cramp. Then just why take MC? Okay, I mean, as a guy, I don't understand. But I think if a female doctor, it would be better for you all to see.
So that's why, in a sense, I'm proud of being a fat doctor because I have the empathy of fat patients.
Yeah,
I feel that I'm in the advantage position because I know how it feels being fat. Empathy. That's
empathy
good.
part is very important.
Because as a young doctor, sometimes you don't really, unless for example if you are a cancer specialist, you don't have cancer, then you are there's just sympathy versus empathy, that kind of thing.
You mentioned it last episode. Very different. That's also the reason why a human doctor is better than AI doctor. That's what we covered last topic.
Yes.
So I think hopefully we get to see more female patients. You can come down to our Punggol and Sumang branch. For female doctors, even Seletar Mall, even we have our female doctors everywhere. Now, especially like Dr. Lai say, we have increase the quota for female doctors, or there's no quota anymore.
No more.
So don't be afraid. You can ask us and just give us a WhatsApp and see if there's any female doctors working. I think one of the doctor is also Francan's good friend that he dragged in along. So our female doctors are quite a vibe lah. So y'all don't be afraid. They really know what they're talking about. Okay, so hopefully we'll see you guys more often, and then maybe if you're interested, we can talk about more about women, sexual health, or any other topics that you want to ask Dr. Lai, or maybe we can get in our female doctor to go in and you can ask the female doctor as well. Alright, so drop in any questions you have down in the comments below, and thank you so much to our guests who came in over here.